Yes, due to the many inquiries at the Rosengarten Practice Clinic about the P-shot treatment, I'd like to take a moment in this short video to explain a bit about this exciting and very innovative treatment. The P-shot treatment essentially refers to a procedure using your own growth factors and stem cells, which are used to stimulate blood vessel growth in the erectile tissue area of the penis. You might know that during an erection, blood flows into the erectile tissue. This is what actually creates the erection, making the penis hard and firm and causing it to increase in size. The blood remains in the erectile tissue until it eventually flows out again, causing the erection to subside. For this purpose, the erectile tissue has, in its innermost part where it is anchored in the body, supplying vessels, kind of like water pipes, that carry the blood. Through a specific treatment, namely the P-short treatment, we can change the density of these vessels in the area of the erectile tissue. In this case, change means that through a treatment, we stimulate the growth of blood vessels and increase the density and the number of vessels that connect at that spot, so to speak. For erections, this means that more blood flows into the erectile tissue more quickly, which can positively affect the size of the erectile tissue, as well as the speed and intensity with which an erection can occur. Such treatments are especially interesting for patients with erectile dysfunction or weak erections. These often occur with age or after surgeries. But of course, they're also for younger patients who want to positively influence their penis size and erectile tissue size through a P-shot treatment, or who want to intensify their erection and thus their sexual experience. The treatment actually consists of 2 to 3 individual sessions, each spaced about 4 weeks apart. On the day of the treatment, a blood sample is taken, and from this blood, the growth hormones and stem cells are then isolated. During this time, the patient simply has a coffee and reads the newspaper for a bit, and then a small local anesthetic is applied above the penis. Through 2 injection points, the so-called PRP, that is, the fluid containing the growth hormones and stem cells, is injected into the area of the erectile tissue. The effect does not occur immediately because the blood vessels first need to grow and connect to the erectile tissue. That means, after the injection, you won't notice much difference during the first 4 weeks. Then comes the second injection, and after that, the formation of new blood vessels takes place over time, and the erectile tissue becomes increasingly better supplied with blood. There are actually hardly any risks associated with this kind of treatment. It does need to be performed by a professional, because on the one hand, the PRP, the substrate, must be prepared correctly, and then, of course, it must also be injected in the right place and in the right amount. For this, we have established protocols that we developed ourselves, which we use to ensure the greatest possible treatment success.